Good morning. This is Dr. Yonette, and welcome to Baby Talk. Today, I want to talk with you about a condition that affects older children, children between the ages of 5 and 10. And that condition is called Tourette's syndrome. Now, many of you might be familiar with this syndrome, but let's take a moment to understand what Tourette syndrome is, what are some of the symptoms that you should look for, and how to take care of a child who has this condition. Now, Tourette syndrome is a condition that affects the nervous system, and it's caused when people have tics. You normally describe it as the child having tics. And the information that I'm sharing with you this morning comes from the CDC. So tics are these sudden switches, twitches, or movements, or even songs that people do repeatedly. And people who have tics, really, they can't stop their bodies from doing these things. It just happens automatically. So, for example, if you have a child that has Tourette syndrome, you might find that that child is blinks over and over and over again, or the person may make grunting sounds. They're just sitting there and then you unwillingly, it just comes out spontaneously. Now, having tics is a little bit like having hiccups. And even though you might not want to hiccup, your body does it anyway. So sometimes people can stop themselves. Children can stop themselves from doing certain tics just for a while though, but it's very, very hard. And so eventually the child has to do the tic that is like a part of their syndrome. There are two types of tics that you can expect to see in a child with Tourette syndrome, and they are motor tics and vocal tics. Motor tics and vocal tics. With motor tics, you see movements of the body. Example, the blinking, like I talked about before, the shrugging of the shoulders or the jerking of the arm. And when you have a child with vocal tics, you would hear the sounds that a person makes with his or her voice. And these tics would include humming, clearing the throat, and yelling out words or phrases. So Tourette syndrome is the syndrome where you could probably hear a child using profanity. It just comes out. It just blurts out of the child's mouth, and the child has no control over it. Tics can be simple or they can be very complex. If the child has a simple tic, this will involve just a few parts of the body. For example, it may just involve the eyes or sniffing. But if the child is demonstrating complex tics, expect to see several different parts of the body being involved. And there's a pattern to the demonstration of these tics. And an example of that would be bobbing the head, jerking the arm, and then jumping up. So the child is doing like 2 or 3 or 4 motor movements in a case where there's a complex tic. Now, let's look at some of the symptoms of Tourette syndrome. The main symptoms, like I said earlier, would be the tics. They usually begin between the ages of 5 and 10 years of age. So the first symptoms are often motor tics that occur in the head and the neck area. So you may have your child growing and developing normally, and then about the age of 5 to 10, you notice that there's something different or strange happening in your child. And it may resemble these symptoms that we are talking about this morning. Tics are usually worse during times when the child is stressed or very excited. And they tend to improve when you calm the person down or you give the person or the child an activity to focus on. So there are two strategies that you can use if you are noticing that your child has Tourette syndrome. The types of tick, however, that the person engages in can change. The ticks change over time. And even though the symptoms may appear or disappear and then reappear, the condition is a chronic condition. It never goes away. In most cases, ticks will decrease during adolescent ages and early adulthood. And sometimes they may even disappear entirely. But many people with Tourette syndrome experience tics in adulthood, and in some cases, tics can become worse during the adult stages. Now, how is the Tourette syndrome diagnosed? There is no single test to diagnose Tourette syndrome like a blood test, but health professionals can look at a person's symptoms to diagnose whether or not the individual is having experiencing Tourette syndrome. And tick disorder disappear from each other from, let me say this again, the tick disorders differ from others in terms of the type of tick present, motor or vocal combination, or both. Okay? And then how long the ticks last. So you're looking at the ticks, how they present in terms of whether they're motor or vocal or their combination, and you're looking at how long those symptoms last. Tick can be diagnosed if a person has both motor and vocal tics and has had those symptoms for at least a year. So you want to look at your child over a year span to see if these symptoms are being demonstrated, and then you can the health professionals will help you with that diagnosis. Now let's look a little more deeply into the treatment of tics or treatment of Tourette syndrome. There is like no cure. Like I said, the condition is chronic. There's no cure for Tourette syndrome, but there are some treatments that are available to help manage the tics. Many people with Tourette syndrome have tics that do not get in the way of their daily activities and their daily life. So they do not need any treatment, but with medication and behavioral treatments, the children or even adults can end up managing these tics, which can lead to pain and injury and interfere with school and work and the individual's social life, or even cause stress. All right, what are the risk factors and the causes? Scientists and doctors really don't know the exact cause of Tourette syndrome, but the suggestion is that it's an inherent genetic condition. This means that the child inherits it from the parents. So, moms and dads, today's discussion is about Tourette syndrome, and we are saying that Tourette syndrome affects children between the ages of 5 and 10. And I want you to keep, as you see these symptoms appear in your child, start journaling. Start journaling so you have information that you can share with the professionals. And then over a year's period of time, we can come to a conclusion as to whether your child is experiencing Tourette's syndrome. This is Dr. Yonette speaking with you this morning and thanking you for joining me. Remember, you need to take care of yourself first. First, take care of yourself. Be knowledgeable. Know the information so you can do the best job at taking care of your baby and your child. Tomorrow is our baby playtime or play group. So be ready and be prepared as we come together again tomorrow. Have a great day and look for the signs in the development of your child as you raise the next awesome generation of children.